Welcome to yet another edition of Thursday Thought Leaders with Harbinder Narula at BW Healthcare World. My guest today is Dr. Sanjeev Singh, who's a medical director of Amrita Institute of Medical Sciences and Research Center at Faridabad. He is also the Chief Medical Superintendent at Amrita Institute of Medical Sciences, Kochi. He's been there in the industry for more than 2 decades and has been working towards blending technology, passion, and inspirational mentorship to bring back the touch of care into healthcare. Being a pediatrician first, he further completed his PhD in infectious diseases and worked extensively in creating and developing most advanced in-house software along with the cost-effective care for all healthcare-associated infections. He's played a pivotal role in creating standards at both the hospital level as well as during the formative years at NABH as a member of their technical committee. Welcome, Dr. Sanjeev Singh, to BW Healthcare World. Thank you for taking out time to speak with us. My first question to you is, can you tell us the philosophy behind setting up of Amrita Hospitals? And I'm specifically asking you because this comes from a very different institution.
So thank you, Harbinder ji. I think it was very, very nice to have caught up with you. And then congratulations for all the good work which you do on a daily basis in healthcare. So a lot of people have asked us what had been the philosophy and why Delhi NCR and why in Faridabad. Overall, we are led by a supreme divine figure. She is Mata Amrita Anandamayi. She is our Sadguru, and she basically touches people's heart, and she goes from various places and she speaks to people. She hugs people and listens to their vows and understand what would be bothering her. During this whole process, there are people who reach out to her to mentioning that they would like to have such and such work to be done. And they have always heard about good work which is happening at the healthcare setup in Kochi, which was established in 1998. And then there are few more smaller hospitals like tribal hospitals, palliative homes, hospice, which also have been doing fairly decent coverage in the population. So during the time when she reaches out in India and abroad, they request her to set up a similar facility because there is a facility which is required, which is non-commercial in nature, which reaches out to people, which touches the people's heart, and they provide care which is actually noble in its approach. Healthcare has always been noble. Unfortunately, it has its own connotations right now, but that was the intent. And that is how that's had been a complete philosophy. People would have approached her when she travels in North India. And then she decided to establish almost a similar facility, what is there in Kochi. It's a 1350-bed university teaching hospital. But overall philosophy remains to provide a very comprehensive healthcare, which is evidence-based, which is science-based, which touches people's heart. So compassion is one of our key ingredients. We are very high on technology, but we are very high on touch. So that is where I think Amma and her intent of having put in more facility like that had been the core belief and philosophy. So institution which is high on technology, which is evidence-based, which is high on touch and compassion, which is also brings in values of research and reaching out to the community. It had been an overall philosophy of creating an institute like that in Delhi NCR.
And Dr. Sanjeev, you and I were talking, and you mentioned how you came in touch with Amma almost like 2 decades ago. And you have been associated with Amma and her healthcare initiative for the over 2 decades. How do you see your journey at Amrita Hospital? How has the healthcare evolved in the last 2 decades as an offering from Amrita Hospitals?
So that's a very good question. We strongly believe that Amma picks ordinary people and with an intent of doing some extraordinary work. So I think I joined her institution in somewhere around mid of 2002, and it has been a fairly magical and a very meaningful journey. Healthcare has changed a lot. The intent earlier had been that you reach out, but then now cost is a driving factor, technology is a driving factor, plus reaching out with compassionate care is also important. So providing an outstanding healthcare which is evidence-based, which doesn't compromise on quality, which is high on technology, is the need of the hour, and that is where the healthcare right now is driven. So earlier it was when I had joined, we were a university teaching hospital. We were looking at providing best of care. We were looking at getting a medical school established. We were looking at nursing school and nursing college, pharmacy, dental. So all of this facility exists in Kochi, and academics was one of our forte. Clinical care was another forte. And then we brought in research where clinical trials and clinical research and a mix with the nanosciences happen. Right now, it is extremely different. It is very much digital in nature. It is, as you were mentioning, other than the word of mouth, there has to be a digital reach. The technology has to be supreme. It has to be cost effective, because cost definitely within the society, it is one of the driving factors. Plus, you need to also build in talent and competency with the faculty, the doctors, with nursing care, which was not present earlier because it was very individualized practice of medicine. So if you're a good doctor, there is a good clinic and there is a good nursing home and there is a good hospital, which no longer exists. It is a very team medicine approach where you bring in multidisciplinary care. You get a very competent and skilled faculty. You have to get a very competent and skilled nursing staff, and you have to get a good, competent and skilled allied health science people who all sort of come together and deliver care which is benchmarked, which is of international standards. And that has been the aim for establishing Amrita Hospital at Delhi NCR. And that has always been the aim of being an institute of excellence and deliver that kind of care to the people who trust us.
Right. And when you set up an institution as large as what you have done, what is the kind of investment that has gone into building Amrita Hospital?
So investment would be large. I may not be able to know the exact figure, but investment is definitely large because it's 133 acre of land, and it took a process of getting, though it was always declared as institution land, but there was a process of acquiring that, and there it is all been done by Mata Amrita and my trust. So there is a participation of university because we are a university since 2002. And there is also participation from Mata Amritanand Trust. So there is a bit of donations, which has also public money, which has come in. But majority, it has been a university-driven project. And university has put in a large sum to be able to make this campus. So it basically consists of a large hospital, which is a 38 lakh square feet. It also has a medical school. It has a nursing school. It has an allied health science school. Where we are extremely unique is it has a 7-story, 3 lakh square feet of research block. Most of the research institutes are standalone. Here we would wanted to make a difference within the healthcare campus where we are delivering this service. We wanted to have a research based facility so that it is more integrated and holistic. We also have a 4-story building of almost 1 lakh square feet of simulation training and development. Now, a lot of advanced skills are where the companies take the faculty to US, Europe, or Southeast Asia, where we think that it could be reversed and it could all be done in India. There is a mission which Prime Minister Modi has taken of churning out 1 lakh MBBS doctor every year, which is very, very good to meet the population versus doctor ratio. But it also brings in a compelling objective of providing those skill sets to all of them. And we believe that skill-based training would be extremely important because the faculty and that would not be available at all the colleges. And then there are other facilities which are also sort of available. So it overall has been a university-driven project. And then a lot of donations also have come in, which has helped us to build this facility.
Dr. Singh, how have the procedures and practices undergone changes to focus more on patient safety and outcomes? And the reason I'm asking you this is because you run an hospital, you're also producing medical doctors, and you're also focused on research. How have things changed between the last maybe 10 years, bringing back the focus on outcomes and patient safety?
So that's a very important question, and that is the question which every healthcare professional should ask, and those who are especially building a facility should definitely ask. So patient safety is an very important component, though we are a most populous country, and patient lives should matter to everybody. So if the patient comes at our emergency room, we have provided 4 negative pressure. No, negative pressure rooms doesn't exist in in almost all the facility, because one, it's a different engineering concept, plus it requires that kind of a door to come in. So post-COVID, there had been a lot of changes. We have incorporated those changes. So at emergency room, you get a decontamination area done. You have a separate burns unit. So most of the corporate hospitals or other hospitals wouldn't invest because that's a very public hospital-based service. We have 4 negative pressure rooms. So if you have an airborne isolated organisms being carrying and you don't know at ER because you have not been sort of diagnosed, you are to avoid transmission-based infection, you are immediately segregated. So you're protecting patients, you're protecting staff from these infections. At our if the patient gets shifted to a critical care unit, all the critical care rooms are cubicle rooms. So those are patient-safe design rooms. And you should visit our facility and see, because it's something which is very unique. There is a satellite nursing station, there are glass cubicles, there is individual patient rooms, and our intent is, again, very early movement out of the critical care facility. So rehabilitation is important. So every critical care room has a rehab facility, a reclining chair. Every critical care room has a dialysis facility, so the patient don't move. So the transmission of infection, which is one of our major concerns in India because antimicrobial resistance is very high, has all been taken care of when we have designed this facility. Other than that, patient safety, there are many other objectives which have been also fulfilled. We also have something called as utilization review. So our nurses are empowered. They look at appropriate stay of the patients. They look at appropriate pharmaceutical prescriptions. They look at appropriate diagnostics, and they look at appropriate evidence-based treatment. So our again intent is to empower clinical staff, nursing staff, and other allied health science staff to be able to deliver best of care. Utilization review concept also is very new to the country. And we have been doing this practice to be able to say that we cannot be writing battery of tests, battery of prescriptions, and then it increases the cost of care to the patient. We have a lot of stewardship practice. We look at antibiotic, antifungal, antitubercular prescriptions. We look at diagnostic stewardship so that all the samples which goes in are all appropriate and are tested properly and then sent. We look at prescription practice, diet practice. So there is a lot of this culture of patient safety which has been also set in. We very uniquely, we have also established patient safety within the institute. So we, as the patient gets discharged, we ask them whether they would like to participate to make it the whole process as more transparent and approachable. So patients participate in our feedback analysis and they come in for our meeting to tell us whether we are educating them properly, whether their rights and responsibilities have been protected, whether the complaints and vulnerability has been addressed. So there are many, many unique steps which has been taken. And other than most of the clinical work, which also are internationally benchmarked. So every clinical department does clinical audit, clinical effectiveness, and which is also being presented. So we believe that we have taken a phenomenal step, and that's an area which is very, very close to my heart. Patient safety, establishing culture, and putting all evidence-based care in the interest of saving their lives is one of our important and critical philosophy.
And Dr. Sanjeev Singh, a large hospital means large requirement of manpower itself, both for medicals as well as non-medicals. I mean, you have so much of support staff that you need to run a hospital. Do you face this challenge of finding the right people? And if you do, what is it that you are doing to manage it?
So very pertinent question, especially in India. We have 1 million doctors short. We have 2 million nursing staff short. We have 3 million allied health sciences short. And that is why our institute is slightly different, where we are not only running a facility for clinical care. We would also like to contribute back to the nation with academics. So we have a medical school, and medical school is also extremely different, where we provide 240 hours of value-based education, where and that's where we create a difference, where the medical students are also given patients, where they wheel in patients for investigation, they wheel in patients to the critical care or to the operation theater. They own the patient. So a medical student would take care of 10 patients. So the patients also relate easily, other than the nursing and the doctors who are taking care, and then medical students would learn. Similarly, we have a BSc, post-basic MSc program in nursing, and we realize that in India, though 5,500 nursing colleges exist and we are producing so many nursing, we still have large attrition, and it is going to be extremely difficult. And for the next 1 to 2 decades, it is going to be, again, very critical to retain this group of people. So how do you do that? You run these programs which are important. The allied health sciences, which is a very appropriate question. So we run close to 28 allied health sciences courses. We run courses from physician assistants to physicists to radiology technicians, cath lab technicians, dialysis technicians. So they come very handy to us, because those we don't run a diploma and a certificate program. We run a BSc and MSc and a PhD program. So they are available to us as part of training and plus part of internship. So other than that, we also are very strong with social sciences. So we run a clinical psychology program, we run medical social workers program, we run masters in public health program. So being, other than the clinical care, being part of this academics and research, there are lots of PhD programs which are also there. It helps us, one, to create that talent pool, and the pool to take care of clinical work which is required. We run masters in public health, so we go back into the community and do a lot of public health policy advocacy work, which is again important. Health education, health literacy is very essential in the country. So we strongly believe that this particular group whom we train, they would go back to the society and create a lot of difference. My last point is, we are doing this for the undergraduate, postgraduate within our facility. Since we have a very educated, talented, experienced group of people, we get a lot of observership, fellowships, and certificate course demand across the country as well as internationally. So we have trained a lot of doctors. They have come from Sri Lanka, Tanzania, they have come from Middle East, they have come from Europe, and they get trained and they go back and start a facility, and which we are very, very proud of. Though I said it's the last point, one last point is that when we train these people who are allied health sciences, they come and do GDA training. Few of them are so brilliant, they immediately get into an operation theater technician, they become a CSSD technologist. They're so brilliant that now they are there, and there are 38 of these people who joined at Cadre 1, who were general duty assistant. They are trainers in Singapore, they are trainers in Malaysia, and they were not able to speak English properly, and they are making a huge difference. And we are extremely proud of producing such talented pool.
I'm sure. I mean, this is a brilliant testimony of the quality of work that you are doing in educating people. Now, Dr. Singh, you're a multi-speciality hospital, right? But every hospital that I've seen is known for this one core specialty. Is there something that is true for Amrita Hospital as well? Are you consciously building some course, excellence of or an area of competence within Amrita Hospitals?
Yeah, so it generally happens like that, but I think our core specialty would be that we have everything under the roof, and they all are institutes or center of excellences. So we have 81 subspecialty, which is again the largest clinical service which we offer in the country. But as you mentioned, there are some center of excellences which we are focusing right now, but we definitely are very close, and we are passionate about all the service. But then oncology, comprehensive oncology care, which is medical, surgical oncology, radiation oncology, and palliative medicine, is one big focus. Cardiac sciences is another big focus, which is both adult cardiology, adult cardiovascular, pediatric. Many of the institutes don't have an exclusive pediatric setup, pediatric cardiac setup. We have been running a flagship program for last 20 years, and we have done phenomenal work in pediatric cardiac care, both cardiology and cardiovascular thoracic. Neurosciences is again a big focus, both in adult and pediatric. We have a very decent focus on gastrosciences. And again, here we have divided just to create more specialization. Gastromedicine and hepatology and gastrointestinal surgery and hepatopancreatic biliary surgery is separate. We have largest approvals in series of solid organ and composite tissue transplant. So we are not just doing liver and kidney. We do heart, lung. We also do, we have the largest series in the world to do bilateral hand transplant. We have done first trachea transplant, we have done first larynx transplant, we do abdominal one, we do face, we do skin, we do penis. So we are doing all bone, cartilage, though the money earners would be possibly liver and kidney, but then there is equivalent stake with disease donor program. So we do all of it, and that is where we are very exclusive. So it's just not about doing what others do in large number, but also keep on doing where the transplant need is there and then the competency is not available. We also have a large mother and child setup. That's again a center of excellence, where we have fetal medicine, reproductive medicine, very advanced neonatal services. our whole hospital is divided into three zones. And one of the areas which we are very proud of is a children's super specialty hospital. So in India, there are a lot of mother and child, there are a lot of children hospital, but we have taken a plunge, and adult medicine has shown enormous strides. But pediatric subspecialty like pediatric hepatology, pediatric urology, pediatric neurosurgery, pediatric neurology, pediatric cardiology doesn't exist, because unfortunately the trained manpower doesn't exist, and then that kind of a care doesn't exist. So we have almost everything under the sun. So there are 350 bedded pediatric, children's subspecialty hospital, and then the other two zones where we do both economy subsidized and corporate care. So our focus is definitely few center of excellences, but then we have 81 subspecialty, which we are very passionate about.
And Dr. Singh, building up this infrastructure costs a lot of money, and you have to keep it upgraded. Today, a hospital which comes from a philosophy of charitable is not expected to be in a dilapidated state. It's still expected to be the modern hospital, well equipped with the latest technology. Now, how do you price the services that you're offering so that the affordability can be maintained, yet it's not a typical corporate hospital?
Difficult question, but good question. I think you need to visit our hospital to see how it has been built. It's a large setup, so we do work on volumes. But then AMA also makes it very clear that we need to be affordable, and we need to also reach out to people. So that makes us very difficult to give it at a price point which is lower than the lowest of the other hospitals which are in competition. But that's how she asks us to run the hospital, and that's the strategy which we keep, and that's how our hairs turn gray, and that is what we need to do on a day-to-day basis. So to give you an example, that it's a comprehensive setup. So it's a clinical care, we do academics, we do research, and then we do also public health. So the intent again here is we do collaborate with a lot of people. We do collaborate and establish very advanced learning and development center. To give you an example, we did collaborate with one of the robotic vendor, and we have established the only Southeast Asia robotic training, which does two days or 3 days of big animal training and 3 days of human training. Post that, you get a privilege to do a robotic clinical work. And that is where we establish those setups. And because of this collaboration, we get few of the things at a decent price, and we pass on that benefit to the patient. So it may sound very simple, but it isn't. There is a lot of strategic work which happens at the background to give it at a price point. But we want to be sustainable. So it's not a free facility. It's though it has been run by a charitable institution. There is a 16-story building, which is economy wing, which is free and subsidized. There is a 16-story building, which is a corporate wing, which has rooms, semi, super deluxe, and labor delivery suite. So we do an educated Robin Hood style, but then we always ensure that it is affordable to all the patients who come in. And so if you visit us, I think we would be able to explain it more, that how every inch of stone, making it green, making it low maintenance, making it still not look like a charitable dilapidated setup. we had, I think, by her grace, we had made a reasonably well-designed, well-planned hospital.
I think it is very nice because I always keep talking about it that there are these three pillars in healthcare. One is the accessibility, second is affordability, and third is quality. And what you are doing is trying to do all the three together, which I completely agree requires a lot of strategic thinking in being able to deliver healthcare, keeping in mind these three aspects. Now, Dr. Sanjeev, you mentioned that you have a separate building, 16-story building, which is more like a corporate hospital. Are you also receiving a lot of medical tourists in India? I mean, at your institution?
Yeah, so I think we are decently placed. The location helps us. We are 42 kilometers from the international airport, and we have done a lot of good work to reach out to various embassies, to reach out to various ministries. They are also excited. They are all visiting us to have a facility tour. It is a very, very well planned and designed hospital, and they are all extremely excited. We are getting queries from almost all countries, CIS, GCC, Africa, some of the European countries, Southeast Asia, and then some of our neighboring countries like Nepal, Bhutan, South Sri Lanka. So we are reaching out to all of them. We have done 2 kidney transplants. All of them have been international. We are doing a liver transplant that is international. We have done a bone marrow transplant, 15, that is all international. So very excited of the medical contribution to the medical value travel. We recently also participated in this Government of India and FICCI-based Advantage Health, and we saw a lot of traction to Amrita. One, because of our philosophy of providing outstanding evidence-based healthcare without compromising, and very high on technology, but with high touch and compassion. They love the talent pool which we have, because the talent comes from across the country and across the globe. There are many people who have come from UK and US. So they love the talent pool. They love the staff and the allied science group of people who are associated. They love the concept of comprehensiveness in healthcare delivery. You will be surprised to also know that one of our monk visits the nearby villages to understand the underprivileged and disadvantaged girls, and we bring them here and train them free of cost. So all of them who have visited internationally, nationally, they love the whole concept of empowerment of women and reaching out to the society. We do a lot of tree plantation programs with our neighborhood. We do a lot of cleaning program, Amala Bharatam program of making it cleaner. And so the whole philosophy attracts international travel plus the domestic travel. And we are extremely excited about this journey. We are just 8 months old. There are a lot to go. There are a lot to deliver, but very, very excited to be in this space.
Dr. Sanjeev Singh, you have been with WHO in the past, and now you have been with over 2 decades with Amrita as an institution, and 7 months of delivering this particular hospital in Faridabad. And we are talking of medical tourism. Now, people understand that India has the finest medical pool in terms of doctors, facilities. We now have the most modern equipment available, which you would otherwise find in the West. Now, the only thing is that what about international standards and accreditations? So that people have that confidence that if they're coming to India, the institution is of the same standard or is registered as the same standard as what they would find in their own country. What is your view on this, and how can we make this possible?
So again, extremely important question, and I think everybody as a passionate healthcare should be answering and looking at it. I do agree that we have a great talent pool, and that is reflective in the work which we do on a daily basis. Most of the healthcare setups deliver clinical care which is outstanding and which is top notch and which is stellar and which is comparable to international standards. Now, how do you do that? Lots of, including us and lots of other hospitals in the country, match clinical care with those benchmarks. So whether it is a chronic obstructive pulmonary lung disease coming with exacerbation, so do we work on gold standards, which is global obstructive lung disease standard? If there is a heart failure, do we work on American Heart Association standards? If we are getting stroke, do you actually work on those clinical pathways which is established by American Stroke Associations? Plus neonatal septicemias or healthcare associated infections. So most of the good accredited hospitals are doing reasonably well. What is important is that they need to, one, collaborate, and second, pass on this information and disseminate this information to all, which is lacking. So our clinical outcomes should be more transparent. It should be there on our websites. It should be available for anybody who would like to seek in that information to be able to make that decision to come to India. And that is where we will become international. There should be more international accreditation standards, adherence within the country. We have a National Accreditation Board of Hospitals, NABH, which has done fantastic work since 2005. And I've been chairing the research and part of the technical committee where we draft standards. There is an NABH international wing where we are working with a lot of other neighboring countries to also bring some kind of a patient-centric and management-centric standards. But there is a lot of work to be done. One, to become more transparent, to collect a lot of information, to disseminate that information. We have 70 indicators which we capture. So are we benchmarking to state standards and national standards and international standards, and brings patient safety as part of the culture? And just not right now, it is very individualistic. So there are islands of excellence, but those islands of excellence needs to collaborate together, team up, and together make that kind of a difference where we build in. Accreditation is about bringing the public confidence in providing those compliance to the standards. So I think people like you who have been passionate in digital as well as print media should publish more of the success stories, because there's huge work which has been done by the government. Heal in India, Heal by in India is a fantastic campaign. There's a lot of infrastructure being built, which is superb. There is a lot of good connectivity which has been established. There is a lot of one-stop arrangement being done by the government so that medical visas are easily available and they can easily come to the country. There's a lot of reverse brain drain which has happened. So most of the hospitals are good in technology and good in the great clinical care which they offer. I think if we present it as an overall package and that we meet those and create that confidence to them, it will have a large impact. But we also require your help.
Absolutely, sir. Absolutely. I think that's our duty as a media to bring this and showcase it to the world as to the competence that we have already built in. Dr. Singh, Amrita is present in Kochi, and now you've set up in Faridabad. What is the philosophy of choosing these cities? And also, I mean, I know the great work that you as an institution do. What is it that you're doing to serve healthcare in underprivileged areas, underserved areas?
So the two facility, the 1350 bed at Kochi and 2600 bed at Faridabad, those are university teaching facility. But we also have a large tribal hospital at Kalpetta in Kerala, which serves the tribal population and very undeserved, underprivileged group of people. We have lots of palliative homes. We also run hospice home from in Bangalore, Mysore, in Bombay, till Bombay. There are lots of which are also run. Many of it runs free of cost to be able to make that difference. Where chronically and terminally ill patients need not, they cannot afford and they need not come to the hospital. And we do either a home health care or establishing this hospice, palliative homes, and a small hospital. So we need to we need to build more. We need to look out wherever there are an area of need and in different geographic location. But I think large facility like this would be more of a university teaching facility, which definitely is on the lines of creating an institute of excellence. And we are one by National Institute of Ranking by Human Resource Development Ministry. We definitely should look at explore options of establishing more smaller hospitals to be able to make difference, and explore more opportunities of geriatric cares, home health care, palliative cares, and digital care, to be able to reach out to those people who are underserved. We have been running a very large telemedicine program, and we are connected to Leh and Ladakh remote facility. We are connected to Lakshadweep. We manage almost more than 500 islands, small islands in Lakshadweep. We assist the government hospital, and we have a hospital in Andaman and Nicobar. So those are remote areas. We are connected to Northeast remote locations through telemedicine. We have done telesurgery through telemedicine, and that is again where nothing was available. So other than education, we do clinical care. So I think there is a lot of work to be done. We would seek your advice because you have been in touch with large key opinion leaders in healthcare, and let us know where we could reach out and make a difference.
Absolutely, sir. And Dr. Singh, when we launch a new hospital and we are looking at the population to start coming there, utilizing the services, they always compare it to the other hospitals around. So one is the cost, second is the competency. Now, competency requires a lot of reaching out and building confidence on the people who are serving at your hospital. So how do you build visibility for your doctors, etc., so that people are aware of the competency that the institution is offering?
Yeah, it is. One is definitely a word of mouth, where we need to deliver that kind of a care where patients are extremely satisfied. There is a delight factor. There is always a wow factor. And believe me, you need to come to the hospital to see what kind of surgical services is being provided. And it is just phenomenal. And we are very, very proud of our faculty, who many of the cases who have been refused. And we take up all those complex cases, and we strongly believe that there is a remarkable difference which has been created through these word of mouth. But I do recognize the fact that word of mouth will take its own lead time. We do reach out to people digitally. We are there in most of these social media platforms, and we monitor our net promoter scores. We monitor our reviews. We monitor our presence and look at the leads and the hits which are there, which is again extremely important. We have taken an understanding of at least creating a large facility and creating a sub facilities of information and outpatient clinics, and from Jammu and Kashmir to Northeast states. So right now, you'd be surprised to know that we run 84 outpatient clinics other than this large hospital. So which spreads from almost Srinagar to Mizoram, Gangtok, Sikkim, and covering part of Uttar Pradesh and Madhya Pradesh, wherever this kind of care was not available. So the intent again is to make services visible. People know that there is a good talent which is available, and these are fantastic human beings. We have been very carefully. We have carefully selected people. We have interviewed them. We have met them. We have taken their peer reviews, and fantastic human beings. So whenever they reach out to all these and they are part of these clinics, they create a huge difference, and we are seeing a lot of traction, a lot of positive feedback. So one is definitely word of mouth. People know us as, if you talk about Kochi facility, people know us that facility which delivers quality, and we are making a difference through digital. We are reaching out to people like you to help us transmit those positive informations which are there. We are also looking at delivering just not average run-of-the-mill work. We are looking at complex procedures. We are looking at multidisciplinary procedures. Where we are very different is we don't look at individualized medicine practice. We have built teams. A good example is that head and neck oncosurgery works with plastic and craniomaxillar and dental. So they work as teams. So they take 4 departments take one decision for the patient, where we build confidence to the patient. Similarly, in pediatric care, the cardiologist, the cardiovascular, most of the medical people don't even talk to the medical people. So here the medical people are talking to the surgical people, the medical social worker, the psychologist, the dietitian, they all come. So we run a lot of these multidisciplinary clinic, and there is where we build confidence of the patient. So they are, up till now, we are 8 months old. They have been extremely excited with, and we are very encouraged with the positive response we have got from the society.
And Dr. Sanjeev Singh, I'm very keen to ask you, you're a medical doctor, and so do medical doctors make better healthcare business leaders?
I think you know the answer. The answer is no.
Why would you say that, sir?
Because they're not trained like that. Somehow the genetic makeup doesn't sort of promote that kind of a practice, and they are very bad with finances. So it takes a lot of time to learn, to understand the return on investment, to understand EBITDA, to understand how do you put in a strategic plan. They are extremely good clinically. They are fantastic skill sets. They reach out and they explain it to the people. They're a good communicator. But as long as the patient care is there, they are superb. They are top notch, and they do some stellar practices. When it comes to running business, that is a very different, I think, expertise and a core competency. But I also strongly believe that a clinical person, if they acquire those skills of leadership, of business acumen, of strategic planning, of good operation management, of process reengineering, they would run the hospital much better, because they know how the clinical decisions are also taken. They can engage with the physicians because they are the movers and the shakers, and they have invested into your core philosophy and your institution. So right now we do lack healthcare professionals and leaders as a good business people. But then I think lots of things are changing. They are also learning management skills. They are learning finances. They are taking fantastic decisions, and more mergers or acquisitions which are happening across the country. More such decision making, either forced or they need to be sort of inspired to learn this. And I really would like to believe that more clinical team gets into leadership, gets into good management principles, gets into good business principles. I think we would run this noble business profitably and run it well.
Right. And Dr. Sanjeev Singh, what is your plan for Amrita Hospital, especially in Faridabad? for the next 1 year. What is your vision to take this to the next level?
So we are at a super accelerator mode. We started in early September, and the first thing which we did is to have an accreditation for university. So this is an 8th campus university for us. So we are accredited being an Amrita Vishwavidyapeetham at Faridabad. We have started the postgraduate program in nursing. We are now accredited by National Medical Commission to run the medical school. We are now accredited to run allied health science courses, and we have gone through our board of studies and academic council and got an approval from the university. This is all is happening within the period of 8 months, and people would take years together. We are also introducing a very unique course, which is called a PhD program for clinical team. So generally they do an MD or they do a DM or an MCH, and then they do clinical practice. We are trying to encourage clinicians to become clinician scientists. So there will be an MD PhD and there will be a DM PhD program. By doing this, they become good clinicians and they become good scientists. And that is where you would make a huge difference in changing the healthcare paradigm within the country. So that's in the bit of academic area. We, as I also told you, that we are socially committed to reach out to people who are underserved. So we are reaching out to these people, and then we bring them for various training programs, which we provide also free of cost. We are at many of these. We have adopted 15 villages in and around Faridabad, where we also run clinical care programs for them. We have adopted some 10 resident welfare associations, and we run a family medicine program. We have a clinic there. So where we are very different is we are not looking at running these programs in resident welfare gated community, which has 3,000 flats, to convert people and get admitted to Amrita. There we also do bhajan sandhya for them, with them. We also do yoga and meditation with them. We also do tree plantation programs with them. And we also do Mother Earth cleaning program with them. So we are looking at prevention. We are looking at promotive care. We are looking at spiritual care. So that's where we intend to make a difference. We have also established in 10 villages tailoring program. So we are empowering women, and the things, all the linen which comes to us are tailored with them. So we run a very sort of a big self-help group. Clinically, within the facility, we have 64 theaters, 540 critical care beds. We have a pediatric hospital. So we have opened 500-bed hospital, and we have 81 super specialties. So we are looking at providing a team medicine comprehensive care in all these areas. So we are looking at clinical care. We are looking at academic care. We are looking at research program. We right now have a big clinical trial almost in all specialty. We're also very excited to do basic research, clinical research, database research, and environment research and community research. And we are collaborating with many good centers. When we inaugurated, there were 8 Ivy League institutes which had come in and have agreed to work with us. So there were Harvards and Arizonas and John Hopkins and UC Davis and UC San Diego. And yesterday also we had a team from Stanford. So we are very excited to work with them. They are very impressed with the facility, very impressed with the intent of the facility, very interested in doing collaborative work. So all of it, this is happening within an 8 months period. So I'm very excited to know what's going to happen 1 year from now, or 2 years from now, or 3 years from now. But we are there to make some remarkable value-based addition and create a difference in the society.
I'm sure that with the work you're doing, it's going to happen. And Dr. Sanjeev, before I let you go, my one question to you is, what is your personal passion? What is your hobby? What is it that you do when you are in your free time, if you have any free time?
I would, no simple answers because it sort of changes, but I would like to, I do jog, and that is what I love. And second is to sit down and introspect whether today was a good day for me. So do yoga and meditation to understand whether who am I, and am I making a difference in me first, because generally we tend to change the society. And what Amma says is that paristhiti is not important, it is the manasthiti which is important. And I'm trying to figure out whether my manasthiti stays intact and I'm able to understand who am I, and create that kind of a healthy and happy atmosphere within me, within my family, within the institute, and then whomsoever we interact on a daily basis. And that's the small dream which I have. And let's see whether we, by Amma's divine blessings and grace, we are able to do in small gestures.
I think that's a beautiful thing. I mean, understanding that manasthiti is so much more important than paristhiti, because as a business leader with so much of responsibility to build an institution which has a beautiful intent to run a healthcare facility with a noble intention without making it commercial. I mean, we need to sustain the institution, but profiteering is not the objective. So to ensure that you work on the three pillars as we discussed, it is extremely important that manasthiti remains stronger than the paristhiti. Dr. Sanjeev Singh, it has been such a brilliant conversation. I really enjoyed speaking with you, understanding the philosophy with which you have not just built this institution, but the way you are taking it forward to make it useful to the environment around us. And what is also beautiful is the work that you are doing beyond healthcare, because all the things that you spoke of, that cleaning the environment, doing yoga with the neighborhood, helping them do meditation, bhajan, etc., is just leading them to actually stay away from needing a hospital. So and that is the first and foremost thing that you can do to help prevent rather than looking at cures. So thank you so much for joining us. It has been a beautiful conversation. We value your time, sir.
Thank you so much. I really enjoyed talking to you, and those are very good questions, very incisive questions. But I think you give me time to also introspect that what we are doing, is it a value add, or are we making a difference? So I would really like to invite you to visit us and also guide us, because we are new to Delhi and NCR. You have enormous experience meeting with all these high network individuals or key opinion leaders, and you know so much. So we would like to prick your brains, look at your experience, and help us design and sort of deliver what would be the best impactful societal based healthcare.
Absolutely.